My guest is Valda Ford. I am Chuck Gallagher. We have been talking about men's health and prostate health, and we went down the rabbit hole of prostate cancer and the issues that can take place following. The assumption at this point with what we're talking about is a man has not been diagnosed with advanced prostate cancer.
Right.
Talking about getting diagnosed early on and recognizing that as a guy, you kind of come to the conclusion, okay, I'm going to live through this. This is not going to be the thing likely that will take my life. Now what? And the now what, in terms of side effects, is incontinence and sexual function.
Right.
Or impotence.
Right. So we looked a little bit at the whole issue of erectile dysfunction, and that is usually the thing that men are most worried about.
Absolutely.
Absolutely, it's the thing. So when we look at erectile dysfunction, first of all, you should know that if it's going to happen, it can last from 2 months to 2 years. So men should not be thinking, oh, well, my neighbor only had the problem for 2 months, but up to 2 years you can get back function. And there are some other things that you can do while you're waiting for that to happen, or if you do not get back the function. But let's just say, you can start with those little pills we hear so much about, right?
Right, absolutely. In fact, when I was diagnosed, the doctor said to me exactly what you're saying. He said, generally, you have to assume it'll take about a year. Mm-hmm. And he said, you'll need some aids. And I'm going to prescribe for you Viagra, or Cialis, or Levitra.
Right.
I think those were the three biggies at the time.
And they still are.
And they still are. And at this point, I think Viagra is now in generic form.
Well, I'm sure most men would be happy about that with the cost situation.
Oh, yes.
But anytime there are others, then usually the cost goes down. But those things will work if the nerves have not been damaged.
Yes, that's absolutely correct.
Right.
Right.
So we got to recognize that in order for the medications to work, they will serve as a stimulus for the nerves to work, and then you get your erection. With those kind of medications, of course, the potential side effect is that your erection doesn't go away in a certain amount of time.
Valda, I have never had that problem, and I have to tell you, I know that's serious.
Yeah.
Okay, I know that's serious. So anybody watching the video, I'm not making fun, but you know, if I had an erection that lasted for an hour, I'd be like, yeah, that's what I'm talking about. But
Right. We're talking about
4 hours.
4 hours.
I know,
right.
yes, and that it is a serious medical issue.
Right. Yeah, because untreated, it can end up where you're in danger of losing your penis.
That would be a bigger problem.
That is the biggest possible problem for men, right?
Absolutely.
I don't even care what's happening. But then there is a prostaglandin type of medication that can actually be injected into the base of the penis.
Okay, so let's talk about both of these for just a second.
Okay.
Okay. I was given prescriptions for Viagra and Cialis. Mm-hmm. Now, my personal experience was Viagra was maybe a bit more effective, quicker, but the side effects were more pronounced for me. Mm-hmm. And in my case, the side effects were swelling in my sinuses, so it became not impossible to breathe. That's way out there. But it was like having a really bad cold.
Right.
It was just not as if we were sitting here right now.
Well, the common side effects for those type of drugs are headache, flushing skin, upset stomach, light sensitivity, and runny or stuffy nose.
Right.
Rarely these can cause any vision problems, but other drugs such as nitrates, which treat heart disease, can cause problems if you're taking these. So this is why no one should just decide to go online, order these from out of the country, get some from a friend. You absolutely need to have the correct health status before taking that.
Absolutely, and I think that's a really, really, really valid point. Before the doctor ever prescribed anything, it was, do you have heart issues? Are you taking anything because of the potential really devastating
Right.
impacts that took place?
Right.
Now, for me, Cialis was, well, I'm going to call it less potent, but I could take a Cialis pill and within generally 36 hours, there was the potential for it to work. Whereas Viagra, you take it in 4 hours, it's probably not going to be very effective.
Right. Well, that's also important. Some people like to take a drug like Cialis because they have more flexibility as to when. So you don't have to know at 8 o'clock we're going to have sex, so at 7:30 I'm going to take this pill. That is all about lifestyle and what's going on with you. So it's up to you and your doctor to decide on that. And then, how does it affect you? Like you say, to be well enough aware. And I think that people should use a little diary to keep up with what's going on, a little log. I took this drug. This was the symptom that I had. And then you want to see if that's just a typical side effect or if it's something that is more dangerous, and just report that back to your physician. You know, I had headaches that were incapacitating. That probably means you don't need to take that.
Right.
And there are always other options.
Now, before we go to the injections, and this is just really, this is a practical comment to make. It's a bit frustrating when you receive your prescription for whatever, Cialis, Viagra, Levitra, that you get 5 pills or 8 pills. It's like, what? And especially after surgery when you're recovering, and as we talked about, the concept of
Rehabilitation.
It's like, well, you know, I want to take a pill for rehabilitation purposes. And they say, well, you know, the average man only has sex, you know, 5 or 8 times a month. And it's like, well, yeah, but I need rehab 3 times a week.
Yeah.
I need a little help here. So you have to think a bit about the frequency in which you would use it, the circumstances under which you would use it, and the dosage. And again, controversy, so you can slap me around a little bit on this. But, you know, you might have a 25 milligram pill, a 50 milligram pill, or a 100 milligram pill. Well, 25 might work or 50 might work, but if they're only going to give you 8 pills or 5 pills, if you get the 100 milligram pill and cut the thing in half, functionally, you've doubled your opportunity in your rehab. Now, some folks would say, well, you shouldn't do that, but it sucks to me that the medical system dictates how many pills I'm eligible to buy in a given month.
Right. Well, the challenge is if you give someone a 100 milligram tablet where really their body will respond to 25 milligrams, then perhaps they're going to have a lot more negative side effects.
Absolutely, no question.
Yeah. So the thing is always to start with what's considered a standard dose, a therapeutic dose, but not to do the higher dose. That gives you room. I hate it that the insurance companies or whoever is deciding what you get and how often you get. But I am just hoping that we'll get more and more into a more enlightened society where we're not trying to restrict people from doing what they need to do to get better, because this is a quality of life issue.
Absolutely. Now, I have a good friend of mine who had prostate cancer. Nerves were spared. The Cialis and Levitra or Viagra wasn't particularly working, and so he had injections and swore by them. Not long after, now I was one of those guys that, you know, 3 months later, incontinence was just a non-issue, but erections would happen rarely, but when it did, it was like, oh, it's glorious. Oh my gosh, there's a possibility, and then nothing and nothing, and it's like, oh, this is becoming quite irritating.
Right.
So I went to a doctor who prescribed injections, and you know, he checked blood flow with a ultrasound. He says, oh, you've got good blood flow. I thought it was kind of funny. Weird experience. And then he said, okay, I'm just going to inject you. And he said, you know, I want you to go in this other room and as he put it, have a rousing erection.
Right.
Well, Valda, I don't like needles. So,
We're back to that, yes.
I got the injection, went to the other room, and I got to thinking about the fact that I just got a needle stuck where I never thought there would be one stuck. And I had to lay down in the floor to keep from passing out. And, 30 minutes later, he brings me back in. He said, "How was it?" I said, "Man, I had to lay on the floor to keep from passing out." And he said, "I don't think you're a candidate for our program." So I know one guy who would swear by it. And in my case, it was psychological. I'm sure it would have worked fine, but psychology, I'm going to killed the erection.
Yeah.
That probably would be a punk song. I could see it,
Sex always starts in the mind.
That's true.
So when the mind is thinking, no, danger, Will Robinson, then it's not going to work out.
There you go.
Yeah.
Okay, now, other alternatives.
Well, let's just explain that
Okay,
there
go ahead.
is an injection.
Yes.
It's a nearly painless injection,
I will agree with that.
right?
Yes.
So most people thinking of an injection, they're thinking needle.
Oh, no.
It's a little tiny thing.
Right. Almost
It
like a
goes-
diabetic needle of some
Yeah,
sort.
exactly, like an insulin needle. It goes in the base of the penis, and they're also using that same man-made prostaglandin can put a suppository in the tip. It's unfortunate that he didn't tell you about that because it's the same medication but used in a suppository form. Now, some people are thinking, I don't want to put anything in the tip of my penis either, but that is the option for that type of medication.
Interesting. Okay.
And a lot of men find that it really works.
Right.
And because there is the ability to adjust the amount, and you put it in 5 to 10 minutes before you're going to have sex, but you can even change the amount to prolong the time that you're going to have an erection.
Okay. Well, for the gentleman that I have talked with that said this is the method that I use, they swear by it.
There are a couple side effects potentially.
Okay.
It can still be pain, though
Right.
it's usually tiny bit, dizziness, and a prolonged erection is one of the potential side effects.
That's what I've heard. Yeah.
Yeah.
Absolutely.
But it's another option that most people don't know about or don't talk about.
Okay, so while we're on this, let's go down the rabbit hole a little deeper. So we've got the oral drugs, we've got the injection that's a possibility.
Right.
I don't even really understand completely the idea behind the pump or the vacuum pump. Yeah.
Okay. Well, the vacuum takes the air out of the machine, and while that's happening, it pulls blood into the penis.
Okay.
And erection is all about blood flow.
Right.
No blood flow, no erection. I don't care what else is going on.
Right.
So it's just pulling the blood into the penis.
Okay.
And while that's there, if your mind is right and everything else is going on, it's great. And then what happens is you maintain it when you remove the pump with a big rubber band that
Okay.
keeps the blood there.
Okay.
So it's a mechanical function that's just getting the blood there where your nerves aren't set and your mind isn't set for doing all of that. And then you can have a really reasonable erection and decent sex.
Okay. Now, does that, I'm not sure how to ask the question, does it change the experience, the sensation, the physical experience of sex?
Not that I know of. When I talk to guys who have used it, because one, there are people who don't want to put any kind of pill in their body. They
Right.
believe that putting substances in their bodies is why they got the cancer in the first place.
Okay.
They don't want to take anything. There are those who are absolutely not going to use a needle.
Right.
And so they're looking for something that they consider they can control and is more natural.
Right.
And so that's what they do. And I don't know that they have a good comparison. And actually, I haven't sat down and say, if you use these three, which would you prefer? Which one feels the same?
Sure.
But the research that I've done does not have a big red flag to say, but people who do this say
Okay.
there's less sensation.
Okay.
Once you can get the penis to be erect, and then with this method, you're not worrying about it going down because you have physically stopped the blood from going back out,
Right.
then you should be able to relax into it and enjoy it.
Okay. Valda, before we go into another segment, is there anything else?
Yes.
Good. I thought there probably would be.
Well, there's the implant.
Okay.
So if you're one where all these other methods don't work, then there's the possibility to have an operation
Right.
to put a tube inside, and usually it's a silicone rod.
Right.
And it's placed inside, and there are methods where you can have it basically attached so you can inflate it when you want to have sex.
And now I have talked with some men who have had penile implants and very satisfied. The inflation tube nodule, I don't know what you really
Device,
would
we'll
call
say.
it, device,
Yeah.
is in their scrotum. So when time comes for sex, they just reach down and push it, and the next thing you know, they have an
There it
erection,
is.
and their erection lasts until they release or push the device again, and it changes.
Yes.
So for a lot of people, especially if some of the other methods don't work, that will. Now my understanding of that, and correct me if I'm wrong, is if you choose to have a penile implant, that is your only method. There is nothing, because you functionally disabled the place where the blood goes. You kind of functionally disable that by putting the inflatable
Right
tubes
there.
in.
I don't know that to be true, but it makes sense that it would be. But remember, the tube is usually the last option.
Absolutely.
It means that they have tried those others,
Sure.
and blood flow was not sufficient using either the medication or a pump.
Right.
Therefore, this was the option for them.
Okay. Anything else while we're going down this rabbit hole?
No, those are the ways that typically between 2 months and 2 years, the vast majority of men are going to get their function back if they've had a nerve-sparing procedure.
Okay.
The important thing then is to have your mind set for it's going to happen when it happens. I'm going to be ready. Have the type of healthcare practitioner who has told you those different exercises like Kegels to prepare your muscles to be able to help get an erection or sustain an erection when you get one, and then to use one of these methods to help you during that rehab or in lieu of normal function.
Okay. In our next segment, we're going to talk about, okay, function is returned. Now what can you expect? Because there are some things that are a little bit surprising, or can be. My guest is Valda Ford.
Yes.
I'm Chuck Gallagher. We're going down lots of rabbit holes when it deals to prostate health and men's health. Stay tuned.